Okay, folks, good afternoon. Welcome to the end of session wrap up. My name is Aisha Davis. My pronouns are she, her, and hers. I'm the Director of Policy at AIDS Foundation Chicago. I have the wonderful opportunity to help moderate today's conversation. You won't be hearing me much at all today. I'm really here to help be supportive of my wonderful colleague, Timothy Jackson. So today we're going to be discussing all the things that happened in this very unusual legislative session. This year was not one that any of us could have predicted. Well, I take that back. It is a year that not many of us expected, I should say. And we have had to be very nimble throughout the course of session this year. As a result, we were a lot more thoughtful about what it was that we were trying to see happen during the legislative session. It was a shortened session, and a lot of the bills that we kind of went into the session thinking that we would push for kind of ended up playing a backseat role to responsive measures around the COVID-19 pandemic. The one thing I will say, though, is that the work that we're doing that is responsive to the COVID-19 pandemic, especially around the disparities that we're seeing in the pandemic, look very similar to some of the discrepancies and disparities that we've seen during our work on the HIV epidemic. So with all that being said, a few housekeeping things. I think that you can see me and Tim's screen. That's because your cameras are off, your microphones are muted, but you do have the option to chat with us in the chat box, and you can submit questions to the question and answer section. If something is being answered live, I will indicate that in the Q&A tab. If something needs to be asked at the end, it will be. We won't be taking questions during the presentation. We will be handling everything at the end. So feel free to enter those in the chat or the Q&A. Excuse me. Now, I have the opportunity to introduce to you Timothy Jackson. Timothy is the Director of Government Relations here at AFC. His work at AFC includes developing and managing the organization's government relations activities, specializing in HIV-related state legislative matters regarding appropriations, healthcare reform, and policy issues impacting the social determinants of health and health disparities. He brings extensive experience in HIV advocacy, grassroots organizing, political campaigns, and lobbying to the policy and advocacy team. Timothy was born and raised in the Deep South and recently served as a staffer as board president for Thrive Alabama, an AIDS service organization and federally qualified health center, providing medical and supportive service care to the people of North Alabama. His career is centered on a promise made to a late aunt who passed from AIDS-related complications that he would spend the rest of his life advocating on behalf of people living with HIV and amplifying their voices. Timothy is a proud political science alum of Mississippi State University and has a food blog entitled A Man About Food. It is my pleasure to turn it over to my colleague, Timothy Jackson.
Thank you so much, Aisha, for those words and for getting us started on today's webinar. Thank you to each one of you all for joining us today for the end of the session wrap up and for the work that you are doing during these very difficult times. It's going to be a lot of information today, so we're just going to go on and get started. As Aisha mentioned, this session was very unprecedented, unexpected because of COVID-19. Initially, the spring legislative session was condensed. It was condensed into just 19 days instead of the originally scheduled 53 days. It began on January 28th, stopped in mid-March due to the governor's stay-at-home order, and reconvened in late May for a whirlwind, very late hours, 4-day special session. Generally, what I'm going to do today is break down the legislative session into two parts, essentially pre-COVID and COVID. And so if I can get there we go. Like I said, I'm going to break it down into two different parts, pre-COVID and COVID. And so generally going into the legislative session, we had policy priorities that we wanted to push this year, as Aisha kind of hinted to earlier. And so what I'm going to do now is to go over these policy priorities very briefly, touch on some kind of what the legislation is, kind of why we're backing this legislation, and kind of where it sits now. And then we'll proceed on. The first of which is the Illinois Healthy Youth Act. It's legislation that would modernize the state's sexual health education curriculum to one that is more inclusive and affirming. It definitely removes outdated and stigmatizing language and builds on current standards for health and sexual health education courses. This legislation is not a mandate, but does ensure that school districts that do teach sexual health education, grades 6 through 12, that these new standards would be used. We are working with the ACLU of Illinois on this legislation. Representative Camille Lilly is the lead sponsor on it. Unfortunately, due to COVID-19, the bill was not heard in the House Elementary and Secondary Education School Curriculum and Policies Committee. It did not advance in the legislative process, but we do look forward to moving that legislation forward in next year's session. The next one we have is HB 3493, Prescription Drug Affordability Board. We're currently working with Representative Will Guzzardi and Senator Andy Menard on this legislation that basically would create an independent, nonpartisan board tasked with reviewing high-cost prescription drug prices and setting upper payment limits. We are working with a statewide coalition called Protect Our Care, of which we're a leading organization of that coalition. Essentially, as the graphic says there, prescription drugs don't work if you can't afford them. And that's just as simply put that I can get it. We were unable to get this measure out of the House Prescription Affordability and Accessibility Committee, these very long titles to committees. And so we, again, look forward to continuing over the summer into the fall and continuing to push this going into next session. The next topic we're going to talk about is HIV criminalization. Although we did not this year decide to run a bill on HIV criminalization, this is something that is kind of really one of our hallmarks of the items that we're working on. If you're not familiar with HIV criminalization, it refers to laws that specifically target and punish people living with HIV for engaging in conduct that would otherwise be legal if not for the person's HIV status. In Illinois, people living with HIV can be criminally prosecuted for consensual sex, needle sharing, and donating blood, tissue, organ, and semen. Prosecutions under the HIV exposure statute here in the state include a Class 2 felony punishable by 3 to 7 years in prison and a $25,000 fine for a person living with HIV who knows their HIV status to engage in sexual activity with another without the use of a condom and have expressed intent to harm. We are working with the Illinois HIV Action Alliance Coalition on outreach and education of priority population stakeholders and decision makers with the goal of running a bill to repeal this law that I just mentioned in either 2021 or 2022. And again, HIV is not a crime. So if you are interested in joining this coalition, we would love to have you. My information will be at the end. And like I said, we would love to have you to join that coalition, either your organization or as an individual member. Next on the docket is SB 3243, House Bill 4826, Bring Chicago Home campaign. This bill speaks to two important issues. It's a stated goal, addressing the city of Chicago's budget deficit, as well as creating dedicated funding to address homelessness in Chicago. AIDS Foundation Chicago, Pride Action Tank, and the Center for Housing and Health are partnering with the Chicago Coalition for the Homeless and other organizations through the Bring Chicago Home to address this important issue. Again, due to COVID-19, this bill did not advance in the legislative process, but we are looking forward to continuing our advocacy on this bill, as well as other housing and homelessness-centered legislation moving forward. So, the next one on this round robin of policy priorities, HB 4891, Healthy Illinois for All. This legislation just extends Medicaid eligibility to all low-income Illinois residents age 19 and older. This was the original premise of the Healthy Illinois for All legislation, with household incomes of up to 138% of the federal poverty line, regardless of their immigration status. While we were not able to, because of the shortened session, able to get this entire law put in, we were, the coalition, Healthy Illinois Coalition, were able to get amended language placed in what they called the Budget Implementation Bill. And that amended language provides medical coverage for all seniors age 65 and older with incomes at or below 100% of federal poverty line, regardless of their immigration status. This is huge. Like I said, it was included in the Budget Implementation Bill. Illinois is the first state in the nation to provide Medicaid coverage to undocumented seniors. So this is really a huge step in the right direction to make sure that we are providing health care to everyone that lives here in the state of Illinois, regardless of their immigration status. The advocacy with this, yes, we got that language passed by the General Assembly. That advocacy is continuing, working with officials at Department of Healthcare and Family Services to implement the provisions set by Healthy Illinois for All. And so we just sent a letter to Director Eagleson yesterday, imploring her to do all that she can, her and her department, to implement these provisions so that our undocumented seniors can get the health care they need, especially in the midst of a global pandemic. Next one, it's a healthcare affordability feasibility study. This is a simple measure. It's a healthcare initiative from Governor Pritzker that requires the Department of Healthcare and Family Services to conduct a feasibility study that would explore options that make health insurance more affordable for Illinois residents. Language from this legislation was included in the Omnibus Healthcare Package, SB 1864, House Amendment number 5, that was passed by the General Assembly during the special session. Once completed, a report will be submitted to the General Assembly and the governor concerning the design, costs, benefits, and implementation of a state option for health insurance coverage that's due no later than February 28th of 2021. Again, much like Healthy Illinois for All, that advocacy is continuing. AFC is leading a group of other healthcare centered organizations, many of which that we work on a number of other coalitions, to begin having discussions with officials at HFS and the Department of Insurance to make sure that we are putting our best foot forward in providing the affordable healthcare options that the people of Illinois deserve. And the big one, this is a major part that we do each year with our legislative advocacy, is advocating in the Illinois state budget for the HIV lump sum and of course other STI funding. And so in Illinois, there's something called the HIV lump sum, which is about 4 different funds that when you combine them together, they're called the HIV lump sum, that basically provide all of the services for HIV here in the state of Illinois for treatment and prevention services. This year, we asked for and advocated for a $2.1 million increase in state funding in fiscal year 21 for HIV treatment and prevention services. That included funding for HIV testing, for PrEP, pre-exposure prophylaxis, as well as the African American HIV/AIDS Response Act. This year, also to address the growing rates of STI diagnosis across the state, when we're looking at chlamydia, gonorrhea, and syphilis, we advocated for an additional $900,000 in new state funding, a new state funding line item, just for those STI diagnoses to address the growing rates there. And so generally what the the General Assembly did. They passed a mostly level funding for the FY21 budget. And as you can see there on the screen, the HIV lump sum there is $28.5 million for fiscal year 21 state appropriations. And so those were pre-COVID. And then, of course, we know that after session was canceled in about mid-March and during the stay-at-home order, and the policy and advocacy team began looking at how COVID-19 was affecting, and the reports began coming out showing how COVID-19 was having a disproportionate impact on a number of communities, including people living with HIV, people vulnerable to HIV, Black and Latinx and Indigenous communities. And so we pivoted, as Aisha talked about earlier, very quickly, sent a letter to the governor and the Illinois General Assembly asking for some COVID-19 specific funding asks, in addition to the HIV lump sum ask. And so we advocated for $57 million in additional state funding to meet the essential housing and human needs of people living with HIV, people who use PrEP, people vulnerable to HIV. And those needs: food, rent, utility assistance, transportation. These are just day-to-day things that you just have to have. We also advocated for a $1 million investment in Black-led and Latinx-led HIV community-based organizations here in the state to help them weather the economic downturn. Again, like I said just a moment ago, COVID-19 has had a disproportionate impact on those communities, much like HIV currently does, and we wanted to make sure that money would be centered in those communities so we can be provided and get to the greatest need there. Of the total $3.9 billion in COVID-19 relief funding, majority of which is from Federal CARES Act money that the state received. $1.1 billion was appropriated with communities of color in mind, though not specifically directed at Black and Latinx people living with or vulnerable to HIV. Our asks continue. We're currently working with Representative Lamont Robinson on the African American HIV/AIDS Response Act to see if we can potentially get $20 million in that fund. Again, trying to go to the heart of where COVID-19, where HIV intersect and where they have a disproportionate impact on these communities. So with that, again, like I said, those were the pre-COVID and then the COVID policy priorities. And so now, again, like I said, the budget is a large part of what we do in legislative advocacy. And so I am going to talk about next steps as far as how the budget process went pre-COVID, and then, of course, COVID and the special session, and we'll go from there. On February the 19th, Governor Pritzker released his fiscal year 2021 budget, and these are some of the highlights, including a 1.6 increase from the previous year. His budget included revenues from adult use cannabis that was going to generate, $46 million to transfer to the general fund, as well as they had budgeted, Governor Pritzker had budgeted $100 million to the rainy day fund over the next 16 months. Again, this is pre-COVID. Currently, the rainy day fund only has $1.19 million in it, and so naturally there was a need. And again, this was pre-COVID. Again, some additional highlights: there was a $40 million increase to mental health and addiction treatment services, as well as brought back the Healthcare Navigator program with $4.5 million, something that the Trump administration had taken away. And so again, COVID happens, there's the stay-at-home order, and so looking at how COVID-19 was having a terrible effect on the state's revenues. In April of this year, the State Office of Management and Budget predicted revenues would drop by more than $4.6 billion in next year's fiscal year. Moody's Analytics projecting an even steeper drop between $5.2 billion and $6.9 billion, depending on the severity of the economic contraction. And so with that, the State Assembly, the General Assembly, working with the governor, presented a budget that was $42.8 billion in spending, which exceeds available resources by nearly $6 billion. And we'll talk about that deficit in just a few moments. Illinois will spend $2.4 billion, or nearly 6% more than last year's $40.4 billion budget, with a large share of that being two things. One, money from the federal government to address impact of COVID on the state's finances, but then also to address needs. Department of Human Services, total funding $7.5 billion, and then HFS, which of course covers the Medicaid program of the state, $29 billion total funding. So these are some of the healthcare needs. By no means am I going to sit here and read all of this, but these are some of the healthcare needs that the budget addresses. That, again, a large chunk of it came from federal CARES money that Congress allocated to Illinois and has been allocated out for a number of these items. I do want to mention the top two, though. Top 2 points: expands Medicaid coverage for pregnant women from 60 days to 1 year postpartum. That's huge. Our friends over at EverThrive Illinois, part of the Healthy Illinois Coalition, really kind of led the charge on that. So kudos to them, and we were able to get that in the budget. Also increases rates to FQHCs and community health centers. Oftentimes they are literally the center of our communities, providing health care to our communities, and so increasing those rates are huge. Just going to touch on a couple of other ones. $385 million to provide support to providers of long-term care services, which is awesome, especially when we see the disproportionate impact on the long-term care services when you look at the number of cases, as well as, unfortunately, the number of deaths that we've seen. $150 million to support FQHCs, with an additional $40 million to support FQHCs that serve disproportionately impacted areas, which is very awesome to see. That not only are we giving money, but we're giving money where it is most needed. $30 million for mental health, substance abuse, other counseling services, assistance for individuals and families impacted by the pandemic. And so those are all huge points as well. And then the final one, $19.8 million to 9 specific hospitals, determined by looking at some of the most Medicaid-dependent providers in the state. And so these are essentially the safety net hospitals that need, that are in the middle of these communities that are being impacted by COVID and other health disparities. And so this was money set aside just for that, that purpose at addressing some of those concerns. So the budget, as I mentioned, the outlook, there is a $6 billion deficit. And so there are a number of ways that the General Assembly decided to tackle this. As House Majority Leader Greg Harris said, is that they chose the best option out of a lot of really bad ones. And so they looked at initially doing a 35% cut across the board. Of course, that would hit human services, healthcare here in the state drastically. And so, of course, they did not choose that one. And so this is how they're going to deal with the $6 billion deficit. They, leaders here in the state, both the governor's office and the General Assembly, are really looking forward to a potential fourth COVID relief package that will include money to states to help ease their state budget issues. Really hoping that that money is what they call unrestricted funding, which basically allows the governor his discretionary spending authority to move money around to where it's greatest need. And so that's where they're looking that. All indications that maybe Congress will look at passing that package sometime late July, beginning part of August, before they go on August recess. And so that's a good portion of where they hope, state leaders hope, that will fill that $6 billion deficit. Another portion that they're looking at is state borrowing. The General Assembly passed the Cure Borrowing Act, SB 2099, that authorizes borrowing of up to $5 billion through the Federal Reserve's municipal liquidity facility. And so the General Assembly authorizing this legislation, the authority for the state to borrow through the program for up to 10 years. And so that's, from my understanding, depending on what money comes through relief package from Congress, will probably 9 times out of 10 be borrowing up to that $5 billion max, from my understanding. And then there's the third point, sale of backlog bonds. Again, to balance the budget, General Assembly also included about $1.2 billion from the sale of backlog bonds. And so the state, as you may remember, previously sold about $6 billion of these bonds in October of 2017 to pay down the record $16.7 billion backlog of unpaid bills accumulated during the 2-year budget impasse under the Rauner administration. And so you add about that $1.2 billion plus that $5 billion, you kind of add that up, and that's where they fill that $6 billion deficit from. So there are some things that didn't fit nicely in my slideshow. So I kind of created a section called odds and ends that are some important things that I want to share with you all. And then, it shouldn't be very much longer. Then we can get to questions, which I'm sure you all have. Telehealth, I'm sure through COVID-19, what would we be able to do without telehealth? And so on March 19th, Governor Pritzker signed an executive order requiring health insurance companies, Medicaid, to cover services for telehealth at the same rate as in-person visits, which has been huge. And so during the special session in late May, the General Assembly looked at ways to extend, because right now that executive order for telehealth, once the disaster proclamation fades away, so does that authority. And so the General Assembly wanted to look at ways to extend telehealth services. And so initially they had legislation in Senate Bill 1864, House Amendment number 5, that would extend it for up to 12 months past the public health emergency. So if the emergency ended June 30th, we could go to June 30th of 2021, which would be huge. The insurance lobby would not support this measure. That portion of that bill was taken out and put into the following one, which is Senate Bill 671, House Amendment number 2. And so they worked out, from my understanding, with insurance lobby, that would extend the telehealth services until December 31st, 2020. Now, the measure was voted on by the House, but not by the Senate. And so by all estimates, telehealth is supposed to be discussed during this fall's veto session that I will be mentioning in just a few moments. And so there are also some talks that I've heard that the governor, with an executive order, is just going to extend it to the end of December anyway. And so we just don't know right now. But all estimates is definitely that is going to be a topic du jour during fall veto session. The next odds and ends, fair tax. You may have heard about this. During the election, November 3rd, voters in the state will have an opportunity to vote on the fair tax constitutional amendment. And so currently, the state of Illinois has a flat income tax And if passed by voters in the election, you basically see that change to a progressive income tax that would see the wealthiest pay their fair share. Under the current system, which taxes everyone at the same rate regardless of income, the top 1% of Illinoisans only have to pay approximately about 7% of their income in state and local taxes, whereas middle and lower income families are forced to pay nearly double, around about 13% of their income in state and local taxes. And so essentially what this would do would flip that. And so if you look on the screen there, it says what the fair tax would do for Illinois. Require only individuals making over $250,000 a year to pay more. It would ensure at least about 97% of Illinoisans see their taxes cut or remain the same. A big portion of the money that will come from this fair tax, if it's approved by voters, is additional revenue to fund our schools, to fully fund our schools from the state level, and then lower the property tax burden. And so essentially right now schools are being funded locally by property taxes. And so if we can use the money from the fair tax, then the state can fully fund, and then local governments and local school boards are not having to, they can lower the property tax burden on families. And then also to address the state's structural budget deficit and put the state on the path toward fiscal sustainability. And so estimates right now are that $3.4 billion or so across a full fiscal year will be collected in revenue from passage of the fair tax. Neither the governor's initial budget that he announced in February, nor the budget that the General Assembly approved in May includes any revenue that would come from the fair tax if passed in the November election. So anything that the fair tax, if the fair tax is approved, anything that the fair tax brings in would be a boon to the budget and would help the bottom line, which is awesome. Next one, vote by mail. I'm probably sure you've heard about this one. Legislature passed Senate Bill 1863 that requires election authorities to send vote by mail applications for the November 3rd general election to those who participated in the following elections: the 2018 general election, so the midterms, the 2019 municipal elections, and then of course March's primary elections. There is nothing that you need to do for that. This will automatically happen. If you voted in those elections, you will automatically receive a vote by mail application. The law requires voters who submit an application for a mail-in ballot before October 1 to get their ballot no later than October 6. So once you get that application in, you fill it out, you send it back in, they will send you your ballot. And of course, all of this is done, this is only for this year. This is not permanent. This is only because of COVID and to deal with this year. And again, this is to make it easier on people. Some additional thing that I kind of, it got lost in the weeds of a lot of talk about this issue, expands early voting hours to require polls to be open earlier and later, while allowing curbside voting, which was a big, point of contention when they were discussing this bill, the curbside voting. Another one was 16-year-olds may now serve as election judges. I am all for getting people involved in the whole electoral process earlier. So I am all about that one. Also, it makes Election Day a holiday for schools, which frees up school buildings to be used, again, for voting sites. Odds and ends, medical clinical trials. Go through this one pretty quickly. The General Assembly adopted the language in the final omnibus healthcare package that mandates that Medicaid now cover approved clinical trials. The ACA had already stated that you had to cover clinical trials, and Medicare also already covered clinical trials, and so this was just really them closing the loop. And so I know our partners at the American Cancer Society, Cancer Action Network, worked a great deal on this. AFC supported this legislation, and so glad that the General Assembly was able to pass it, put this in the omnibus healthcare package. And finally, the hospital assessment. Legislators passed SB 2541, a bill that renews the Illinois hospital assessment, that essentially gives the state more money, more funding for those safety net hospitals that I mentioned earlier. Specifically, the plan includes $250 million in increases through the program, $50 million in physician rate increases, as well as $150 million for a hospital transformation fund to help hospitals facing difficulties change what type of institution they are, and being more centered on providing care to their community. I will tell you, this is something that both the House and the Senate, both parties, all worked on, all agreed to. During the special session, this did not get very much debate at all, because the General Assembly had been working on this for months, bipartisan, bicameral, and so this is going to really be a boon for safety net hospitals here in Illinois. So, all of that to say, I'm almost done, y'all. What's next? Each year, usually beginning after session, which is June usually, through the summer, through the fall, AFC goes through a process of determining, hey, what are going to be our policy priorities for the next state legislative session, which would be 2021. Because of COVID, many of our policy priorities for 2020, we didn't get a chance to do. The Healthy Youth Act, HIV, DCRIM, I'm missing one, PDAP, we didn't get a chance to do those. So those will go back on 2021, but we're also currently working on the policy and advocacy team on a new process for identifying what policy priorities will be in 2021. So what if new ones when we're going to add to that list? And so that process is kind of chugging along. We will be getting information out pretty soon. I would imagine the next 2 to 3 weeks on how you can get engaged in that process, because we want to talk to our clients. We want to talk to people doing the work. We want to talk to AFC staff. We want to make sure that we are touching all of the people that will are affected by so many of these policies that we're advocating for. And so we want to hear from you. And so just kind of be on the lookout for more information about that. Also, veto session. November, it's usually 6 days, late fall, winter. November 17th through the 19th, and December 1st through the 3rd. And that's generally where they discuss issues that on bills that the governor has vetoed. There weren't very many bills this year. So this is going to be a very, for him to veto. I was just on a call earlier today with Leader Harris, and he was like, he didn't veto any of them. And so this is going to be a very interesting veto session. So we get to talk about telehealth and the African American HIV AIDS response fund. I'm sure they're going to be talking about another potential COVID package. I know there is going to be some discussion where we look at policing and criminal justice reform. And so I am looking forward to veto session, very much so. But something else, you may say, well, how can I get engaged in what we're doing here at AFC? I encourage you to sign up for our P&A Action Center, and the link is on the screen there. And you can also join our mobile action network. Text AFC to 40649 to receive text advocacy alerts. We do not send out a whole bunch. Just if you're kind of worried about it, we don't send out a whole bunch. But we do send out action alerts like, hey, we need for you to call your member of the legislature or your member of Congress about this potential issue or specific issue rather. And so that is a great way for you to get engaged. And so with that, I'm done. And so it's time for questions.
That was amazing. Honestly, I wish that I had downloaded one of those soundtracks of clapping because that was phenomenal. Thank you so much for sharing all of that information. The presentation was both comprehensive and enjoyable. So I appreciate that. I'm going to go ahead and start getting to the questions. Oh my gosh, the chat is lighting up of kudos for the work you just did. So thank you so much, Tim.
Thank you all.
So the first question is, do you anticipate, well, given the shortened schedule this year, do you anticipate bills will be refiled with amendments to reflect the pandemic and current conversation around racial equity next session, or do you imagine that they will just be different bills?
Both. I have heard on a couple of different instances, some of the bills you have generally in a normal session, you have bills that people put in every year. And so you get used to that. But then there are a number of, I'm thinking of like Senate Majority Leader Kim Leifert has been huge on talking about criminal justice, and she's been really kind of pushing the ball on that, and from my understanding, working on kind of a package herself, along with some others. So I am sure that there are going to be additional bills there. They will probably be leading the discussion in both veto and session for 2021. Veto is literally only 6 days. And so Leader Harris even mentioned there may only even be 3 this year.
Wow.
So don't know exactly how much we're going to be able to get done. But, you know, it can literally be anything. But I'm sure there will probably be additional bills about COVID. And kind of addressing those issues. The bills that they were able to do earlier during session, the special session was primarily about really 2 big things, the budget and COVID. Now, there were some other smaller things that they worked on, but they had to. But those were the 2 big things, and I'm sure COVID is going to be the talk of both, not only the veto session, but going into 2021 as well.
Got it. Thank you. Another question about the HIV lump sum. Which sources of funding make up the HIV lump sum?
Look there. I'm so glad somebody asked me that, because I am prepared.
And it's not even anyone from AFC. It wasn't a Planet question.
Now they are called, y'all, of course, it's the African American HIV/AIDS Response Fund. That's the portion of it. It's one called Expenses of AIDS, HIV Education Services, Prescription Drugs, Correctional Facilities, Counseling, Testing, and Referral and Partner Notification. So that's one. Oh, and Patient and Worker Notification. And then there's just the there's just a general line item that is primarily of the funding. The African American HIV/AIDS Response Fund, that one. And the one that I just mentioned, those are smaller. But then you have the main one, which was Expenses of AIDS, HIV, Education, blah, 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 blah. That's the larger chunk of the funding. So that's where they are.
Got it. So we have funding from state general revenue funds,
yes,
as well as other funding. Awesome.
Now, and I'm glad you mentioned that. That's what I mentioned today about the HIV lump sum. That is only state general funds. That's not counting any of the money that we receive from the federal government. So.
Got it. Perfect. Thank you so much. And for folks who are watching and don't work at AFC, Tim's preparedness today it's not special. It's all okay, a question about the fair tax. How can the passage of the fair tax in November impact the HIV sector and people living with or vulnerable to HIV in Illinois?
Wow. Wow. I'm going to be honest with you. In full transparency, I will. My colleague Nadine Israel is really, really good on the fair tax. And so if Nadine is on, if she does not mind.
I'll take that one because I know that we've been working as a group on this.
Okay.
But from my understanding of the fair tax, what it means for people living with and vulnerable to HIV is that there will be increased funding available for the work that's being done to ensure that those communities are able to not only access comprehensive and compassionate care, but to make sure that folks stay connected to care. So mostly the influx of funding that will come from the fair tax, if it is passed, will just ease funding and allow more programs to be funded that specifically work for these communities. So yes, similar to everything that we're talking about, honestly, and what Tim mentioned earlier around the fact that the budget was written without including any revenue generated by the fair tax if it's passed. It means that anything that we would get from that could help all the programs that we've been discussing throughout the presentation. Yeah, no problem.
Thank you for covering that. Also want to mention, because I don't think I've mentioned it, it is really important that we do get everyone to vote for that, because it is a 60% threshold that we must meet, because it's a constitutional amendment. We have to have a 60% of the vote. So that's important.
Awesome. Thank you. Okay, so we have some more questions. Here's a fun one. In spite of all the unexpected complications this year, what is a favorite moment from your first legislative session here in Illinois?
Wow. Although it did not turn out the way that we wanted it, we had the Protect Our Care Coalition, of which AFC is a leading organization. We had an advocacy day for our PDAB bill. And we had over 250 advocates down in Springfield that when I tell y'all they cut up, they showed out. I mean, it was just an energy there. They packed the committee room. I mean, there was this life that was, it was so good to see. It was a lot of hard work, but it was so good to see so many people engaged. And I mean, some of them were taking legislators to task. I mean, some that were on the fence about the bill. And so that was probably my favorite point in a month and a week in Springfield. So
I know, what an interesting time to have joined. More questions about next session. So with what is currently known and projected about COVID-19, it's likely that there will be another spike or wave in cases. If the General Assembly is not able to return to a quote unquote regular session next year, what is AFC's plan to continue to advance things that were moved to the back burner this past session, and to advance new opportunities or bills?
We're already doing it. The one thing with the whole COVID thing is, of course, it's kind of hard, you're stuck in the house kind of, thing, but you're always kind of thinking of, what has this helped? And so this has allowed me and our policy team to continue that advocacy. Just because we didn't have session didn't mean that we stopped working. One thing that I've been so proud to see our team work on is really, yes, the legislative part stopped, but our advocacy on the administrative side, as far as trying to making sure about Medicaid waivers for COVID and all of these different administrative barriers that we've been able to work to remove so people can get the care that they need, that has been so fulfilling. We're still meeting about the Healthy Youth Act, just had a call Monday about that. We had a prescription drug affordability call, if I'm not mistaken, yesterday morning. So still working on PDAB. Before this call, we were working on HIV decrim. And so it's just, it continues on. It's a lot of people think that just, well, it's no longer session, you're not as busy. We're probably busier now than we were during session. And so, which is saying something.
That's real.
Great question.
Yeah, it was a good one. Another question about session. So knowing that there were declarations that had to come from both the state and the federal level around the pandemic being considered an emergency, and that it might be declared over by the time next session happens, but that the effects will still be felt in marginalized communities, right? Can we expect COVID-19 to be a major topic next session?
Absolutely. Absolutely. Governor Pritzker and his staff and the leaders, the General Assembly that I talk to, that's all they're talking about. And so it is because they understand, yes, a declaration can say it is over. That does not mean that COVID is over. And it does not mean that the impact of COVID and other health disparities end just because, a health emergency, declaration expired. And so they are committed to continuing trying to do what they can to move us forward and provide care to people and services to people. We know that COVID is going to have a huge impact on next year's budget discussions. So definitely COVID is going to be at the center of probably everything that we do in 2021.
Okay. Another question about this year. So Tim, what ways can advocates expect to engage during the veto session?
Sure. One of the things we are working on is, like I talked about, telehealth. And so we are looking at, and this is very, very early, some thoughts that I've had is really doing some education for advocates, making sure they talk to their legislators. And so signing up for our advocacy team, our advocacy action network, the text alerts is going to be helpful in getting you engaged. So, when we say, hey, we're working on telehealth right before veto session, and we need for you to call these 10 legislators, or we need for you to call your legislators because we need their vote. We need them to support this bill. So that's going to be a great way to get engaged. Something else we're doing over the summer, we're doing a lot of outreach work for IHOG, which is the Illinois HIV Action Alliance, our HIV decrim work. I mentioned earlier about our outreach and education there. And so we are going to be doing a number of community roundtables in the next month and a half or so, as well as some other meetings with legislators and whatnot. So just stay tuned.
Awesome. And I think we have time for one more question. So I'm going to just take advantage of the fact that I work with you. So I get to throw a question in.
Okay.
And it's based on what you just said, actually, around the changes that happened during the COVID-19 pandemic, like around telehealth access. What, if any, ways do you think that we can continue to advocate around, one, continuing the access that we've seen during the pandemic that it's been really wonderful for our community members. It's helped to increase a little bit of the equity that we've been talking about, right?
Sure.
So how would we be able to engage with legislators around either expanding or just memorializing and making permanent the changes that have happened during the pandemic?
Sure. I mentioned earlier some of our administrative advocacy work that we've done during COVID. We are working internally on a report of policy recommendations that, yes, they were great while we're dealing with COVID, but they're great because they're great and they help people. And so we want them to go long term, that actually Aisha is working on. And so spearheading. And so I want to get people engaged in that once that report is done and out. But also make sure that you are dialed into your legislator. Many of them have Facebook pages, social media. They all have staffs that may be a bit different being with COVID, whether they're open or not, but engage with them. If you have questions about a particular subject that you want more information on, that's what we're here for. Reach out to us. Our policy and advocacy team, I work with a great group of people that's what we're here for. So we're here to be kind of your education, place where if you have questions or ways that you can get engaged in the community with your legislators, tap us. We can definitely get you headed in the right direction.
Awesome. So we're at that point in the presentation where you can give us any last thoughts that you have before we just close it on
out. Again, thank you to everybody that, I don't know, why am I? Anyway, oh, there it is. Thank you to everybody who joined us today. I have really enjoyed it. I'm going to be honest with you. I was stressing out, y'all. but because it's a lot of information to give you in such a short period of time. Thank you for the great questions. Thank you for being engaged. We really lean on you. So again, like I said, those different ways of engaging not only with us, but with your elected officials. We really crave it. We need it in order to do our job effectively. So if you have any questions, there is my information. Call, text, email, and we will definitely get back to you. Again, this work is very enjoyable because we have people that we get to advocate on behalf of people like you. So thank you again.
Thank you again, everyone. I will personally say a big thank you to Tim for not only giving us this lovely presentation that was informative and engaging, but also doing all the work necessary behind it, right? So not just creating today's webinar, but actually doing all of the dedicated and difficult work throughout session, especially during a pandemic, especially during this larger conversation around anti-Black racism and equity.
Yes.
So we appreciate all the work that you've done, both publicly facing and internally. And I am very thankful to work on a wonderful team that has you as part of it. Also, attendees, thank you so much. Oh, yes, Tim, go ahead.
If you would like the slides, just shoot me a quick email.
I was going to say, that was going to be my last announcement. All of the slides will be available. We will be sharing them with the folks who have registered. Additionally, this presentation was recorded, and we will be sharing the recording with folks who have registered, as well as posting it for AFC. So if you had any more questions or wanted to reach out or wanted to rewind anything, that'll be available. And also, I would be extremely remiss if I did not give a huge shout out to Meg McElroy, who has helped us with today happening and making sure that everything went off without a hitch. Honestly, I don't know how we do this work without her. And thank you to Nadine Israel, who is our fearless and tireless leader. We really appreciate all the work that y'all have done to help make sure that this happened today. So have a wonderful weekend, everybody. Make sure that you're taking care of yourselves. Remember, we're still in the midst of a pandemic. And even if you don't feel like that's something that's directly impacting you on that level of being like dealing with COVID-19, remember that all the other things that are happening are still something you should be thoughtful about. So take care of yourselves. Have a wonderful weekend, and we'll be here for any questions that you might have. Thanks, everybody.
Bye-bye.